Could this be the return of doctors' house calls and car park visits in the wake of coronavirus? A primary health organisation is warning people with symptoms that could be COVID-19 not to wander unannounced into medical clinics, as they could be putting other patients at risk. ProCare contracts the services of the Westgate Medical Centre, where a woman, later confirmed to have coronavirus, walked into urgent care without letting doctors know she was coming, despite signs saying people recently returned from overseas with symptoms should not enter. The doctor who swabbed her is now also in isolation. ProCare's clinical director, Dr. Allan Moffitt, says if you are displaying symptoms of concern, don't just show up.
It is still possible that people walk into a clinic without seeing the sign or reading it or just disregard it. In that case, actually, people aren't greatly at risk because the virus really you need close contact over about 15 minutes to be sort of at risk. So obviously different if they're coughing actively in front of people, within a metre, that's a concern. And so that's why we like them to phone first, because we can arrange for a mask to be fitted and so forth so that they don't spread their germs.
A staff member has contacted the media around this. Why would you think they would do it? Because they're saying it's because they're deeply concerned.
Well, I'm actually really surprised and disappointed that a staff member would do that. They should raise it with management of the clinic, but I can understand all healthcare workers being concerned because, of course, this does put healthcare workers in the front line at risk. But providing you follow the ministry guidelines and wear appropriate protection, then, this thing's really, it's quite safe to see patients and treat them appropriately. And that's why it's essential that the public do ring first rather than front up with cough. Now, while we don't have community spread in the country, it's only people that have travelled that we need to be concerned about. So the staff at general practice clinics don't need to be concerned about, the general public rocking up. It's only people that have travelled, and I think it's generally well known now that those people should not front up to their clinic without phoning first.
In saying that, someone did do that. So I'm wondering how many of your patients at that clinic are now having to be contacted by the Ministry of Health. Do you know how many there are?
No, I don't know that. And, it is important that they track where the person was and how that came about. And I believe that is underway. But the risk is actually very, very low. The proper procedure should be that when somebody comes in who has travelled, that they get isolated in a room with a mask to minimise harm to other patients and to the staff.
So what is the situation with the doctor who treated this woman?
Look, I'm not familiar with the details of the case, so if there was concern, if the doctor had spent a reasonable length of time with the person, that doctor will be in isolation, so will now have to stand down for 14 days until, he's proven negative or she's proven negative.
Yes, so the doctor is being stood down until about March 16th, I believe it is. So
that would be right.
How many patients would that doctor have seen after contact with the patient who is a confirmed case?
There's no risk of a contact of somebody with, or the experts are saying that there's no risk of a contact of somebody who has had exposure to the virus actually spreading the virus. The peak time for this virus to spread is really when symptoms appear and then for the next 5 to 6 days. So, we're being careful with 14 days, but the peak time is really from when symptoms appear. So prior to that, we don't think that there's a high risk that people will get infected. And certainly in an acute situation where somebody's just been seen within hours of the contact, there is no risk, so long as the doctor concerned has followed proper infection control around washing hands, and that's the key thing about surfaces and hand washing.
In saying that, this doctor has now been stood down, though. So, and
the
presumably,
doctor has been stood down because there's a risk that doctor may actually be infected, but there's no risk of that doctor transferring that infection to anybody else. That's why we put them in isolation until we know, in case he becomes symptomatic. But
Understood.
If he doesn't become symptomatic, then there's no risk to other people, or if the viral swabs prove negative.
Understood, but there was a 2-day delay in doing that because that doctor continued to work. as I understand
Yeah,
it.
and as I state, and as the Director General has also stated to the public around the Westgate, school students, there is no risk to the public, there is no risk to those students, and there's no risk to the patients that doctor saw from having been seen over those 2 days.
But the scenario that we've just talked through, it's not the ideal situation what happened, is it? So what would you like to say to people about how they deal with this if they think that they're showing symptoms?
Absolutely right. And, it's so imperative that people don't just front up to the doctors and front up to the reception desk. They must call before coming in, or even better than that, before leaving to see the doctor, they can call the 0800 coronavirus line. So it's 0800 358 5453, and those people are skilled around what the advice should be, whether they need to see somebody. If they need to see somebody, then what the process should be.
And the reason you do that, the reason you ring ahead and don't enter the clinic is because if you don't, you could be putting people at risk, right?
Yeah, it's to protect the public from further spread if they ended up being a positive case.
So would a scenario in this case, would a doctor go out to the car park to see someone perhaps, or away from the clinic?
Yes, we have been doing that. There's a range of possibilities, actually, including house calls. If somebody's at very high risk, and it seems very likely, then, it includes house calls. But definitely we can see somebody and assess them in the car and do the swabs as necessary. Actually, the risk is not high to get them into the clinic, so long as they've got proper protection there. So, a person can attend without touching surfaces on the way through, have a mask put on their face. We do need to then clean the room down after they've left, but there's no risk to the public in somebody walking through the waiting room.
But can you understand how a staff member might feel slightly aggrieved by the situation, that they may have been put at risk by this particular person?
I think it's the key thing for all clinics to consider to make sure these staff is safe. If somebody arrives at front desk and coughs all over you and you subsequently find out that they've just returned from China, obviously that's not an ideal situation. But equally, and so we need to do the utmost possible to protect our healthcare workers, and that's what we do. So some practices, are taking extra precautions around that. Right now, I don't believe that that's necessary. The best defence is to make sure that people don't front up if they meet the case definition, which is widely available and known.
That's ProCare's Clinical Director, Dr. Allan Moffitt.